Greetings and salutations, everyone. My name is Dr. David Hartwig. I'm a doctor of physical therapy. I'm the owner of Atlas Health and Wellness. And today our topic is going to be upper extremity strength characteristics in female recreational tennis players with and without lateral epicondylalgia. Epicondylalgia. Epidemiological reports suggest that 40% of tennis players experience lateral elbow pain at some point in their lifetime. This study was designed, or the objective was to compare statistic strength characteristics of the upper extremity musculature in female recreational tennis players with lateral epicondylalgia to those with non-symptomatic tennis players and a control group of women who do not play tennis. What do we got here? So they did strength dynamometry, not with the JTEC systems, another system. That's one of the downfalls of using, dynamometry, but it's also how we try to be more objective about what we're measuring. So let's see, some of the patient characteristics: mean age of individuals that had symptomatic or lateral epicondylitis or osis was 45 years. The non-symptomatic group was a little bit older at 47, and the controls were at 43. The mass of the individuals playing was a little bit lighter in weight for the symptomatic ones, the asymptomatic ones were a little heavier, suggesting maybe more muscle mass. Let's see. Years of play for the symptomatic group was 9 to 7 years, whereas the non-symptomatic group was 13 to 12 years, plus or minus. And of course, that is non-important for the controls. There were 21 individuals in each group, which is 20 is a good N or an acceptable N. It's still a small sample size, but you got to do what you got to do to make progress in research. All right, so what they measured was internal rotation strength, external rotation strength, shoulder abduction, upper trapezius strength, wrist flexion strength, wrist extension strength, lower trapezius strength, elbow flexion, and elbow extension. I don't know why they didn't add middle trapezius. I think that would have been a very important muscle to measure as well as the lower trapezius, but I guess they're trying to establish ratios, because in the table 3, it basically breaks down the ratios of STP being the symptomatic group and non-symptomatic being the NSTP, and then the controls. So internal rotation, external rotation ratios was closer to 1 in the non-symptomatic group, meaning that there was a greater internal rotation strength with the symptomatic, or a weakness in the external rotators. Upper traps to lower traps. The upper traps was much more significantly stronger in comparison to lower traps in the symptomatic group, meaning that there was a force coupling issue with the upper traps being more over dominant. Abduction and external rotation seemed to be exactly the same in almost all groups, so not even significant. Elbow flexion and extension ratios was, about the same. There was a little bit stronger in the non-symptomatic group, meaning the flexors were slightly stronger. And then wrist extension or flexion to extension ratios was flexor dominated in the symptomatic group, meaning that the extensors were weaker in comparison. So the non-symptomatic group and the control group had a closer ratio to 1, meaning that their wrist extensors were stronger. So I'm going to go ahead and roll down here to the conclusion. I don't want to ramble too long. And again, it's a small sample group, so it's hard to deduce everything. And there were some other things that they didn't include in the research, which I would be very curious as to what the data was on their range of motion in their shoulders, the glenohumeral joint, internal, external rotation ratios. Very important in overhead athletes, and I consider tennis players overhead athletes for sure. Although, you got to put parameters on studies. You can't have every piece of data out there, although I'm more of a all data compared to less data, because you can see patterns better. And at Atlas Health and Wellness, we do full body evaluations. We not only look at your strength force couplings, whether you're a tennis player or not, doesn't matter what you're doing. We want to try to make sure that your ratios are healthy ratios. And we use strength testing dynamometry that a lot of researchers use in the field, but it is not unfortunately utilized in the clinic because it is usually too expensive to do, and reimbursement rates for such testing is very low. So a lot of corporations, they could care less as to how close you are to being healthy, which is a terrible thing. Because they're just chasing the dollars, and they're not really fulfilling their ethical obligations. And we're seeing that more and more in the medical community post-pandemic. And I'm not going to go into that because I don't want to get canceled. Well, I don't care if I get canceled so much as I don't want to get booted off of the social media sites that I'm posting on. What they are findings, the relative weakness of the lower trapezius and wrist extensors may be important factors in identifying and addressing tennis players with lateral epicondylalgia pain. The identified group's muscle strength imbalances of the shoulder rotators and wrist musculature may result in a subtle distribution of normal movement patterns, making the wrist extensors more vulnerable to injury. And what they're saying is that the ratio of wrist extensors, the external rotation strength, and the imbalance of the lower trapezius in relationship to the upper trapezius is going to predispose you to having your wrist in a provocative position when you make contact, especially with like a backhand stroke. So again, I'm not a tennis player, but I've been working in orthopedic physical therapy for 12 years now, and there are a lot of interesting things that I find clinically when I do examinations. When I look at the upper body of any overhead athlete, I'm going to look at the wrist. I'm going to look at the shoulder joint, the neck, the elbow. I want to look at all the joints, not just where the pain is, because there is a lot of evidence suggesting that it's not just a elbow problem. It is a full body problem. And that's why at Atlas Health and Wellness, we do full body evaluations to ensure that we don't miss anything. And again, if you are a tennis player and you want to make sure that you're not, that you're well within these safe parameters and you don't have pain, come and get an evaluation. The worst case scenario is you're perfect. You don't pay a thing on the initial evaluation. It's completely free because, you know, we want to put our money where our mouth is. So if you are curious, make an appointment, 954-932-8527. If you got questions, reach out to us at info@atlashealthandwellness.com. My wife will get back to you as soon as she can. Key findings: recreational female tennis players with symptomatic lateral epicondylalgia demonstrate significant weakness in the lower trapezius and wrist extensors compared to asymptomatic players and individuals in the control group. The symptomatic players also exhibited greater strength ratios for shoulder internal rotation to external rotation and upper trapezius to lower trapezius and wrist flexors to extensors, as mentioned previously. Implications: shoulder and wrist muscle strength deficits should be considered in the management of female recreational tennis players with lateral elbow pain. Caution. This was a cross-sectional study with a small group of females, as I mentioned earlier. Therefore, the data do not indicate a causal relationship between factors identified in the sample and lateral epicondylalgia. I agree to an extent. I think that one of the biggest issues is, like this is 20 in each group. And with what I'm doing here at Atlas Health and Wellness, I'm evaluating people without and with musculoskeletal pain. And a lot of these individuals have deficits that they don't even know about. And, unfortunately, a lot of them are like, oh, I'm fine. I'll go out and, do my thing. I'm going to hit the gym, etc. And then, I get a couple weeks go by and I get a call back saying that, hey, remember when you said that my knee would bother me when I did X? Well, you weren't wrong. It's not bad, but you were right. I'm going to make that appointment to help prevent the progression of this problem that you explained to me. And this is the upper body. This is the lower body. So if you don't know what your ratios are and you want to find out whether you are at risk or you want to start tennis or you want to start a new activity and you don't know how your body is doing in terms of how it's running, schedule an evaluation at Atlas Health and Wellness today. We'd love to help you. Our evaluations and consultations, our first ones, are always free. And so give us a try, 954-932-8527. If you got questions, info@atlashealthandwellness.com. Again, strength. This study is missing a lot of information because there are parameters that studies must be held in. I would have loved to have seen the shoulder range of motion. I would have loved to have seen wrist range of motion. I would have loved to have seen all these things because they can also implicate why they're weak necessarily. Like a muscle might be weak, but why is it weak? Are they able to reach above their head fully? This is one of those things that I'm loving about what I'm doing, is getting people on the table, whether they're symptomatic in an area or not. And whereas traditional physical therapists, we're just doing evaluations while you're injured, so we see these patterns. But I'm starting to notice that people have these patterns even before they have inflammation, meaning that these things can be prevented if you get ahead of it. And so we'd love to help empower you to shoulder the weight of your world, whether it's being a recreational tennis player, professional tennis player, a golfer. We really are excited about what we're doing here, and we'd like to meet you. So give us a call. My name is Dr. David Hartwig. I'm signing out.